Hey everybody, Dr. Sean Casey here with Healthcare Complete Back and Neck Pain Center. Today we're talking about the fun winter weather and snow shoveling. So obviously it pops up periodically here in the Midwest, not all the time, but when it does, it's something that doesn't occur a lot. So people get out, get active, go right after it, and a lot of times cause some aches, pains, and injuries. So we're going to talk about two big factors. One, cardiovascular, and of course, musculoskeletal, which is one of the things we specify here in our office. So cardiovascular actually is a really high rate of heart attacks and other heart issues around snow shoveling. Main reason is if someone's not really physically active all the time, it is a quick, intense workout, so that can create a lot of problems. Number two, cold weather causes a lot of vasoconstriction, so those arteries kind of tighten up. So it's a lot more stress on the heart, actually forces the blood pressure up along with doing a lot of heavy shoveling. And some of the issues we'll see is, problems that have been around for a long time you didn't know about all of a sudden pop up. People get dehydrated really quick, they cramp up, and all these come together to sometimes cause some heart conditions. So if you do have some issues, it's always good to get a little help. Take frequent breaks. We talk about staying hydrated. We don't think about it as a workout, but it is a pretty good workout. So getting plenty of fluids and taking those frequent breaks make a huge difference. Now, from a mechanical standpoint, one of the big things we see is a lot of folks not having the right size shovel. So kind of a shorter shovel, doing a lot of forward bending and lifting. So we know as soon as we do this, all that load goes in the low back. So if we're doing this and rotating, now that load is on one spot back here. So first and foremost, if you can, depending on the density of the snow, pushing is always a better way to go. So if you can kind of stabilize yourself, use your body, and push that snow as opposed to lifting and shoveling, it's a lot easier on your back. Taking smaller shovelfuls. If you're doing that, you don't need to push the entire driveway in one swoop. Take a break, move it out of the way, and kind of go to the next pile so you're not overdoing it. Another good way to look at this too is using those legs. So when you do have to shovel and lift, instead of using the back, let's use those legs to kind of squat down and squat back up, kind of coming up and down, keeping the back aligned as much as possible, and then throwing the snow. Another thing we'll see too is sometimes we're more right side, left side dominant. So someone might shovel the snow and always be going to one side, which you end up just working one group of muscles. It's always good to do a few this way, do a few this way, take a little strain off your back, and then take a rest to prevent big injuries. Now, one thing I tell patients is if we're a little sore and tight afterwards, you had a good workout, that's pretty normal. But if you have spasm or pain that remains for an extended period of time, more than a couple of days, just like a good workout, we probably stirred something up and created an issue there. Or if it's severe pain or it's radiating to other areas of the body, it's great to get checked out right away. If you have any questions on that, give us a call here at the office or shoot us a text. We'd be happy to help out. Have a great day.